Come in.
Hi, Brent. My name is Angela. I'm a Harper nursing student, and we're going to do a physical assessment on you today. Is that okay?
Okay.
All right. A couple of questions. Can you tell me your full name?
Brent Vilches.
Where you are?
Your room.
Okay. And what you're here for?
An assessment.
All right. And what's the date today?
Today's the 17th.
Okay, perfect. So you're conscious, your ABCs are intact because you're able to speak back to me. Your cognitive function, you are alert and oriented ×4, person, place, time, and situation. And your speech and communication, you speak to me in proper tone and proper rate. I'm looking at your skin tone and it is appropriate for you. There's no pallor, no erythema, no cyanosis. I can take, let's see, we're going to measure your vitals. So first, your height and weight. Could you tell me what those are?
6 feet tall and 170.
Okay, and so if we were to, we look at our chart for BMI, you would fall in the range of 23, which is in normal range. And then we would assess your vitals. So I can take your heart rate and your respirations, but we'd also look at your blood pressure and your temperature. Blood pressure should be between 120/80. And your temperature should be 98.6.
You got it.
Thanks. All right, so I would assess your pulse. It should be between 60 and 100, and your respiration should be unlabored and between 12 and 20. And they vary between ages. And now we're going to check your vision using a Snellen chart, and I would set you up 20 feet away. Do you wear glasses or contacts?
Contacts.
Okay, so with your contacts in, you should have 20/20 vision. Now we're going to assess your face and head. So your face and head are in with the normal limits. They're normal. I don't see any protrusions. I'm going to feel for any abnormalities, look for lesions. You don't have dandruff, balding a little bit, but any pain or tenderness on your head?
No.
Okay, so there's no depressions, no protrusions. And then we're going to take a look at your facial symmetry, which is cranial nerve 7. So if you could smile. Okay, I see both sides raise, frown. Both sides go down, blink. Okay, and raise your eyebrows. Perfect, so everything's symmetrical. Now I'm going to palpate your temporal mandibular joint. If you could open your jaw. Okay, and stick it out. Perfect. Did you have any tenderness there? So no diminished range of motion, no crepitus, so that's all perfect. I'm going to take a look at I'm actually going to feel your maxillary sinuses. Should feel a little pressure, but no pain. Anything there?
No.
Okay, perfect. So no pressure, no pain. Now we're going to do your 6 cardinal directions, positions of gaze, and we'll also do accommodations. So follow my pen and tell me if you get dizzy or anything, okay?
Okay.
Okay, and then we'll test for PERLA, which is pupils equal reactive to light and accommodation. So if you would just put your hand over one eye. Perfect, I'm just going to wave a light. Okay, and I can see your pupil constrict. Okay, and I can see this one constrict as well. And lastly, we'll test your accommodation. If you just take a look at this. Okay, and both eyes were equal and reactive. We're going to test, I can see your sclera, which are white, which they should be, and then I'm just going to pull your eyelids down to check your conjunctiva. They are pink and moist, but not having any discharge or anything like that. Next, we're going to take a look at your ears, and I can see that they are appropriate for your head. Do you have any pain when I touch here?
No.
Okay. There's no excessive earwax. I don't see any. I'm going to perform a whisper test. So I'm going to stand behind you and you tell me what you hear. Angela is awesome.
Angela is awesome.
Yes, I am. So that is cranial nerve 8 when doing the whisper test. I'm going to look at your nose now. It's symmetrical on your face. I'm just going to take a feel. Do you have any pain?
No.
Okay, so I don't see any swelling or anything like that. I'm going to test the patency if you just push one in. Okay, and breathe in. Perfect. So those are patent, and you look up. And your nostrils are both equal in size, so I can tell that you're, goodness, you're good. Now I'm going to test, look at your mouth. I'm going to inspect your lips, which are pink and moist. Your buccal mucosa, if you can open. Okay, those are pink and moist. Your tongue has the bumps underneath your I can see your veins, and it is glossy. And now there are no lesions or anything like that. Now stick your tongue and say ah. Okay, so your uvula moves, so that's cranial nerve 9 and 10. And then stick your tongue straight out. It goes midline, and that's cranial nerve 12. Now we're going to inspect for any enlarged glands. So first I'll look at your parotid. I shouldn't feel anything. Your salivary glands, and then take a look up. Your thyroid, and there's nothing to feel. There's no abnormalities noted. Now we'll assess your range of motion. You turn your head each way, up and down, and then ear to shoulder on each side. Perfect. So you have good range of motion with your neck. And now I'm going to palpate your lymph nodes. So we'll do preauricular, postauricular, we'll do occipital nodes, and the posterior cervical. We'll do the hold on, the mental, the submandibular, jugulo-digastric, and the supraclavicular, and then the deep cervical. And then just like this for me, and I can see no abnormalities and feel no supraclavicular nodes. Okay. After the nodes, we are going to look at your carotid pulses. So I'm going to feel them, and then we're going to listen to them. So I'm just going to feel here, one at a time. Okay. So that's present and regular, and they're present and regular bilaterally. So now I'm going to listen to them, and if you would breathe in, exhale, and when you exhale, just hold that. And I'm going to listen with the bell for any bruit. Okay, so I heard no swishing. We'll do it on the other side. Okay, perfect. So there's no brewery noted. And let's see, now we'll do we've already done your neck range of motion, but we're going to assess cranial nerve 11, which is shrug your shoulders for me. Okay, and then we're going to do it against resistance. Perfect, so you're able to do that. So cranial nerve 11 is intact. Now we'll look at your upper extremities. I can inspect your skin, and there's no bruising, lesions, anything like that. You're warm and dry. We'll take a look at your shoulders. First we'll do your nails. And I see your profile. I don't see any signs of clubbing. No signs of clubbing. And then your capillary refill is quick, less than 3 seconds. Okay. And now we're going to test your range of motion of your shoulders. So if you could just stand up really quick for me. Okay. So push your hands forward. Perfect. And back. Good. And now to the sides. Good. And you can sit down. Oh, wait, no, don't sit down. Now push out. That way. Okay, now in. Okay, good. And then do this. And out. And then turn them supination and pronation.
Right.
Perfect. And then pull in like this. Pull in. Okay, and push out. All right, and then let me see your hands. Lift up and down. And to the sides. And go like this with your fingers. Alright, so you have full range of motion with all of your upper extremities. You can have a seat. Now I'm going to look at your chest. Now we can take your shirt off. So I'll first inspect his chest, and then I'll inspect the front. I'll inspect the back and put my hands under his shoulder blades. If you could take a deep breath. Okay, and they expand equally on both sides. And now I can take a look at your rate and rhythm. You have normal rate, normal rhythm. You're not using any accessory muscles. I've already inspected, and now I'm going to listen to your anterior lung sounds and then your posterior. with the diaphragm. Okay, so just take some deep breaths. Tell me if you get any faintness or anything like that, okay? Okay. Bronchial sounds are good and clear. Okay, bronchiovesicular are clear. Okay, and vesicular sounds are clear. I'm going to listen posteriorly. Yeah, just turn that way for me. Thank you. These are bronchovesicular sounds. And we'll get into the vesicular sounds here. Okay. All right, so now on your right side, I'll just have you lift your arm forward and take a deep breath in. Listen to 3 areas here. Okay, we'll do the same. And I'll just listen to 2 areas on this side. Okay, good. So your bronchial, bronchovesicular, and vesicular sounds are all very clear. Your, again, rate and rhythm is good. Now we're going to take a look at your neck vessels. So if I could have you lay over here at a 30 to 40 degree angle. And then turn that way, and I'm going to look for any jugular distension. I don't see any. I see no pulsations. We'll turn this way. And the same goes for that side. Come on back. Okay, so now we're going to take a look at your heart and, well, not a look, a listen at your heart. I'm going to listen for the apical pulse, which is mid-clavicular and in the 3rd or 4th intercostal. Okay, and I would listen for 60 seconds normally. And now I'm going to listen to the other heart sounds, which are aortic, okay, pulmonic, tricuspid, and mitral. Okay, and I'll do the same thing with the diaphragm. Listen for high-pitched noises. Okay, perfect. So I heard S1, S2. I didn't hear any abnormal sounds, extra sounds, or murmurs. Now we can take a look at your abdomen. So I'll have you lay down again. Okay, so I can inspect from here. Everything looks symmetrical. And yeah, everything's symmetrical here. No distension, anything like that. Your color is appropriate, no lesions. Your umbilicus is centered where it should be. I'm going to, again, I've looked, now I'm going to listen. Do you have any pain anywhere in your abdomen?
No.
Okay, that's good. All right, so I'm going to listen with my diaphragm in each quadrant. And listen for bell sounds. Okay, so bell sounds are present in all 4 quadrants. Then with the bell, I'm going to listen to your vascular sounds, see if I hear any brewery or anything like that. I don't see any pulsations, which is okay. And then I'm going to listen to your aorta and your renal arteries. Just one of those sounds. All right, so I didn't hear anything abnormal. Now I'm going to do light palpation, and this is just to see if you have any tenderness or anything. And tell me if you feel anything abnormal or painful. And circular motions. Okay, anything like that?
Nope.
Okay, and then I'll do deep palpation, and we'll feel for any abnormalities or lumps. Okay, no pain. Okay, so no pain or tenderness, no rebound, anything. And you're all good there. So we've done your contour, your symmetrical, your skin's appropriate, umbilicus, bowel sounds, renal arteries, aorta. Now we can move on to your lower extremities. So yeah, take your socks off, please. All right, so first we're gonna do range of motion. Or you know what, I'm gonna look at them first. So I'm gonna look, I'm gonna feel, there's no edema, no erythema, no cyanosis, no pallor, no lesions, no bruising. If you can move this leg out and in, and this one out and in, and then against my hand. Okay, perfect. Oops, sorry. And great. Now bend your knee up and move it out, your hip out and in, and we'll do the same on this side. Okay, any pain or anything there? Okay, and then we're gonna look at your ankles. Everything is good here. We'll feel your pedal pulses. Okay, and they are present bilaterally, and they're both strong as the other. And then lift your foot up against my pressure. Good. And then push down. Perfect. I'm going to take a look at cap refill. And they are all less than 3 seconds, so they're quick. Your capillary refill is good. Like I said, your skin color is appropriate. You are also warm and dry. Your temperature seems to be just fine. Let's see. And now we're going to test your, oh, you know what? Could I have you sit up here and we'll do your knees? So we tested range of motion for your knees. And now I'm just going to, against resistance, push out. Okay, and pull in. Great. So your strength is equal bilaterally. Now we're going to do your neurologic testing, and I'm just going to take this cotton swab, and you tell me where you feel it, okay? So close your eyes.
Ear, lip, shoulder, shoulder, chest, hand, knee, leg, ankle, and toe.
Okay, perfect. And while you're sitting like this, I'm also going to test your deep tendon reflexes. And just relax and go boop. Did I actually do it? Oh. Well, didn't even get that. So here's where I would do in the patellar the deep tendon reflex. Just do it. Just do it. Okay. And then if you relax your arms, I would hold on the outside, relax all the way. And I would use a proper apparatus. And you should feel a little bit of tension there. And we'll do the same thing. Perfect. So that's where we would measure that. Okay. Now we are going to do the, let's see. This is going to be sharp or dull test. Yeah, I might use some syringe. And you tell me if you can feel sharp or dull. So this will be sharp, this will be dull. Okay? Close your eyes.
Sharp, dull, 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 sharp, 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 sharp.
Perfect. You passed. Okay. And now we're going to do a cerebral test and touch your nose and then bring it to my hand and go back. Perfect. And the second cerebral test will be for coordination. So if you could stand up over here and put your heel to your shin and move it down. Okay, heel to shin, push down. That's perfect. We've done your deep tendon reflexes. Now we're going to do your Romberg test. So if you turn that way and just close, and come back here, and just close your eyes, and we'll test and make sure you don't fall either way. And so, good. You're able to stand up straight and not have any issues with that. And now we'll have you, lay down one more time and we'll do the Babinski test. And so that's just the reflex of, keep going, bottoms of your feet. So they should Very good. You're perfect. Now we're going to observe your gait. And if you just walk across the room and show me normal gait. Okay. And then heel to toe walking. Perfect. So you're able to, do both of those just fine. Lastly, we're going to take a look at your spine. So stay here. Okay, so it's concave, convex, and then concave again. And now I'll turn you. I'll take a look at his shoulders, and this shoulder is a lot lower. And have you ever had any spinal issues?
No, it's fine.
Oh, okay.
Fisher checked it.
All right, so this one's obviously lower, but you would look at the scapula. Those seem to be just fine. And then the gluteal folds, those are good, so everything is symmetrical except for his shoulders. And I can see this line going straight down. And if you would touch your toes for me. Okay, and I can observe his spine is straight. And then the last test we're going to do is we're going to do the range of motion of your spine while stabilizing your hips. So keep your hips the same way and turn over. Perfect. Your physical assessment is an A+. Good job.